All right. Hello and welcome, everyone. My name is Jen Brown, and I'm the co-director of the Alliance for Research in Chicagoland Communities based at Northwestern University in the Center for Community Health. We're so pleased to co-host today's Institute for Public Health and Medicine seminar. And before I intro our amazing speaker, I'll share a bit about how we got here and how we invited him. So we were established in 2008, and ARC supports and promotes authentic community academic research partnerships that honor, are driven by, and share power with communities as local, cultural, and lived experience experts. In reflection of our principles, everything ARC does is guided by our steering committee comprised of Chicagoland community and faith-based organizations, public agencies, as well as Northwestern faculty and staff who value and use this approach in their own work. So since 2015, ARC has been working to be more intentional and reflexive about racism and other forms of oppression in research and healthcare in ways that we ourselves may be perpetuating these in our partnerships, our structures, and our work. In collaboration with our steering committee and our partners at the Equity Institute at YWCA Evanston North Shore, we are deepening our work and resources in this area, including facilitating 2 cohorts of the ARC Community Academic Anti-Racism Learning Collaborative and developing tools like the ARC Anti-Racism Reflective Practice Tool and Resource Catalog. I'll put the links in the chat later for those who are interested. And at the end of last year, ARC Community Chair Tamara Sutton, who's Program Director at Chicago Youth Programs, and I attended Facing Race 2022. At this National Racial Justice Conference presented by Race Forward, we had the pleasure of meeting Dr. Lopez. Dr. Andres Lopez is a cultural sociologist and professional research and evaluation scientist. He currently serves as the research director for the Coalition of Communities of Color in Portland, Oregon. His role there primarily focuses on leading the Research Justice Institute. The Institute centers research and data justice efforts in support of communities of color in the Portland metro area and the state of Oregon to advance racial justice through cross-cultural collective action. ARC has been enjoying learning more about the Research Justice Institute's approach, and we're totally geeked out and looking forward to the ways that Dr. Lopez will continue to challenge all of us in the seminar today. So if you have questions that you want Dr. Lopez to address, please use the Q&A function. If you have your own resources related to this topic to share, feel free to put that in the chat, or if something that Dr. Lopez shares just brings up an emotion for you, or you want to shout out something, please use the chat for that. So I'm going to turn it over to Dr. Lopez. Thank you so much.
All right. Thank you so much, Jen. Appreciate you and Adela for all your support to bringing me here today with you all. And I also want to send a special thanks to, I'm calling it IFAM, I'm assuming that's what y'all call it, at Northwestern University, as well as the IFAM Center for Community Health. I really appreciate your all's invitation. So my name is Dr. Andres Lopez. I use he, him, and all pronouns. And I'm the research director of the Coalition of Communities of Color. We are a coalition of 19 culturally specific community-based organizations. We've been around for 20 plus years in an effort to really amplify all of the work that BIPOC communities were doing in our region so that we would be more successful together in promoting and achieving racial justice. So I can drop the link to the organization. You can learn more. Happy to chat more about what we do or our research. But today, I really want to focus on a topic that has been 3.5 years of thinking and assessing and engaging in community and discussion. And that is really sort of distinguishing the difference between research and data justice and research and data equity. It's not really, there's not a sexier way to put the language here about these topics. We're working on it. But essentially, we'll get into the nitty-gritty of what all this means. I also wanted to say that I've been recovering from a cold, so I don't normally sound like this, but I am feeling a lot better today, and I'm really honored and privileged to be here with you. So thank you. And before we begin, I just wanted to do a quick shout out to Chicago. My mother's from Chicago, go White Sox. I have a strong affinity and love for that city, deep, deep love for this city. So I just want to send a shout out to all of you, the colleagues who I know and have not met yet. I look forward to engaging more with you and what you're doing out there. So let's begin. So I want to jump right into it because we got a lot to talk about today. I want to begin by, let me do a roadmap. Excuse me, getting ahead of myself here. We're going to start here with defining equity and justice and talking a little bit more about what those outcomes look like. Then I'm going to move into some examples here from Oregon and from our organization that really help us sort of understand what dominant equity approaches look like, how they look slightly different when there's more community-centered or community-led efforts in them, and then ultimately what community justice efforts look like and how they're distinctive. And then at the end, we'll talk a little bit about the equity and justice continuum. I was really hoping to have this beautiful new model to lay out today with you all, but unfortunately, as we all know, research and community work is a lot slower than we always anticipated to be. So we're still working on fine-tuning some things, but I'm excited to share a version with you today and some thinking of mine. And I really, really would appreciate thoughts, comments, examples, concerns, questions, any of those things. Please share with me. This is a community of practice. I don't identify as a cultural sociologist anymore. I identify as a community researcher. And that distinction has been one that's moved away from my own personal expertise and what I bring to research versus what we can do in community together. And how I am a part of a community of research. So that's how I see my work, and I invite you all to be a part of that as I share with you and as hopefully we build some relationships together after this presentation. All right, so let's dive right in. Equity and justice. These two, we have come to define equity and justice, and the reason why is because we see a lot of work. We see these terms used interchangeably, equity, justice, and particularly around racial justice work and work that's done with communities of color. And what I've come to understand that equity and justice work is very different, and it feels very different, and it looks very different. And it's really important that we're honest about that, and that we make sense of why they're different in order to advance both of them. And that's sort of the argument and claim I'm going to make today with you all. So when we think of equity work, I think of dominant-led work that's supported by community. Right? And we really think of it as equity because it really is confined by the agenda and time frame of the dominant, and often the direction, right? The government can only do so much with this data project. This policy only goes so far to advancing food justice, right? There's always these limits and equity work that is almost always defined and bounded by the dominant. And because of that, regardless of, I shouldn't say regardless, see, I'm learning here. Most of the times, even when community is deeply embedded in that work, it is still reproducing dominant equitable strategies. And those strategies are really meaningful. They can lead to really long-term justice and are really essential, right? That we have to bring along our dominant institutions to make them less racist. That is a goal. But equity work often is about tweaks and shifts, but not radical change, not complete disruption, right? And when I think of justice work, I think of the opposite of that, right? That this is actually something that is more ground up, right? That comes from community and that is supported by the dominant, or that should be supported by the dominant, right? And that justice work really is on the desire and visions and timeframes of community. It is that generational knowledge that has been handed down to our communities for years, right? And those are first and foremost for community and by community. And oftentimes they're beyond the dominant's comfort level, right? It is not, we're not there yet. We're talking about defunding police and how we do that, right? You know, the dominant's like, oh, we're nowhere near that place. But what are some equity tweaks we can make to get there, right? So now you're starting to see a little bit of how we see these things as connected but distinctive, and that's important. So I'm going to give you some examples here of what some of the outcomes of equity work and justice work looks like. So oftentimes, good equity work will produce less oppressive, still oppressive, but less oppressive and more equitable organizations, right? So we see organization, this really is about organizations, or maybe even think about your discipline, right? It's about making that be more inclusive, really consider inequities and how they operate and how they're working within the system. And again, I'm being generous here because some equity work doesn't do any of this, and some of it really does push to these limits. But when we think of good equity work, I really do think of organizations becoming less oppressive and really thinking more about what equitable outcomes should look like. I also think of it fundamentally as challenging deficit model. Equity is grounded in this idea of deficit, right? Of that white is the dominant group, and then here's everybody else, and they're compared to this group, and oh, there's some deficit here, so we got to do something to fix that, because equity is about fairness. So we got to make it fairer, right? So this really is the central sort of practice of a lot of equity work, is about using deficit to make claims about inequity, right, to then move us towards action. So that deficit part is always sort of driving the work, right? And I think good equity work starts to get us out of that thinking and starts us to get beyond that dominant way of just thinking about deficit as to why we should or we do equity work. And then I think the third part of good equity work and outcome is about inclusive community models. It really does begin to build trusting relationships with communities that they've never had that relationship, right? Seeing their standpoints and their contributions as really meaningful, and really sort of trying to get at these root causes. Again, just trying to understand them and how we can deal with them, not change them or dismantle them. That's a thing for justice, right? So we see equity work in these ways, very important work, but not the same as justice. So when I think of justice work, I think more radically. I think of justice work as, oh, this should be transforming organizations, but really it's transforming systems. Sorry, this needs to be updated, that part. But we really think of doing work as an exchange of tools for tools, right? To decolonize means to exchange tools for tools, that we're both contributing something and we're in relation to each other, right? And that relational process is what drives our outcomes. It's what drives what needs to happen. Community expertise is centered in large-scale decision making. It has to be the thing that really drives the work. And again, we start seeing these ways in which community does work be more part of our dominant systems, right? So we want to replace our traditional police system with a different system, right? That really is about relational processes and really grounded in community knowledge, right? And something that is continuously reflexive and adapting around power, right? To me, that's justice work. Justice work is also fundamentally about building community power. None of this means anything if community is not building power in this practice, right? And then also, ultimately, we see that justice work leading to self-determined futures. That justice work is really about setting the conditions for how communities can make decisions about what they need for themselves, right? And those new systems, those new models, those new processes start to reveal what that looks like and what it will take to get there. So that work feels very different from equity work, but there's lots of connections between these two things, and I'm going to go over them with you. So before I go into that, I just want to share something. This is from the data center from out in Berkeley, California. They no longer exist, but they have a lot of great resources they still use, and we love this little model of theirs. And really, we think of a lot of equity work over here in the left side column in the today work, right? It is sort of like, how can we bring more of that cultural and spiritual knowledge and more of experiential knowledge into the mainstream? How can we make the mainstream a little bit more inclusive and more understanding of the distinctions between communities, the way power operates in systems, right? A little bit, we're bringing this up, but there's still sort of this hierarchy of knowledge, of what knowledge gets counted as the most useful, the most powerful for decision making, for running our society, for political power, if you will, right? And we see the vision on the right, which is really more in line with justice. That does, of course, value mainstream knowledge, because that's important. We've made lots of advances in science and technology to understand this world and how to improve our circumstances, right? But then that experiential knowledge, that everyday knowledge, that cultural and spiritual knowledge is not seen in the same light as evidence, as guidance, as proof for what needs to shift and change. And we really see justice work as bringing all these things together. Okay. All right, so that's the first part, distinguishing these two. Now I really want to share some examples about equity and justice with you all from my work, the work we've been doing, to sort of give a little bit more flavor to what what I'm describing here. All right, so we call these dominant equity strategies, and I'm not really tied to the language. You'll hear me talk like this because nothing is fixed. We're always learning, we're always growing, we're always changing our language and our models, right? But we think of this as dominant equity strategies because a lot of these strategies really only live within the dominant. The dominant really is the one who's leading them, who's using them, who's advancing them. Of course, community is supporting them, and to some extent, and we'll talk a little bit more on how this becomes more community-centered, right? But we're really starting here. And some examples I have are better surveys and questionnaires. And I'm going to give this example of the student health survey in a second here. Disaggregation strategies, right? Better disaggregation strategies with our quantitative data. Again, a very dominant equity strategy. An open data portal or a data dashboard. And I'm not going to share these with you because I know you've seen plenty of them. And our Oregon, and I'll drop a line here to our state of Oregon has an enterprise-wide strategy for bringing data justice into our state. And so there is a sort of plan to make all the agency's state data available publicly and standardized. So I'll share a little bit more about that, but that's a really strong equity approach. Research and data equity tools like the GARE model, which I'll cover briefly. Inclusive community engagements like facilitating power model, which I'm sure it's pretty common, but I will drop this in the link as well for you all. And then recently we've been working on some data equity evaluations over here with the Multnomah County Library here in Portland to really understand how an organization uses data and in what ways can they provide more equitable approaches to their data collection, use, analysis, sharing, feedback loops, you name it. So these are some examples, and I'm going to walk through a few of them with you here. So this is the Oregon Healthy Teen Survey. It's now called the Student Health Survey, but one project that we did, the coalition with the Oregon Health Authority, was form some community groups, community members, researchers, and community-based workers in Latin, Black African American, Pacific Islander, and tribal nations. And we brought these groups together to look at the data that this survey across our state has been collecting for years, right? For them to see what is this data meaningful? What's good about it? What's bad about it? And it was actually a really powerful process because initially, you're always a little hesitant, thinking, I don't know if this is going to have enough of an impact, or should we be doing this? But our committees really challenged the Oregon Health Authority to ask better contextual questions, right? So when we ask questions about like how much sleep students are getting, or how much courses, how many advanced courses are taking, or how much school there's missing, there is no context there. We don't know why, how, to what extent, what factors of life, what things of structural racism are happening here, right? To influence those things. We actually don't have any action either. We're just tracking deficit, right, over and over. And it's not getting us to any action as to what we do differently than for these students. And lastly, it focuses so much on individuals, an aggregate of individuals. So then it's like, all Black kids are experiencing this, so there must be something wrong with Black kids, right? And we don't want data and analysis to be centered that way. We want to focus on systems of inequity, not aggregates of people who represent inequity. That does not get us to challenging and changing systems, right? So this work, our committees basically said, hey, you need to ask better questions. Students need to be creating some of these questions, right? Wow, mind-blowing. But these were things that were really new to them. And guess what? 3 years later, they've had 2 student steering committees. There are 4 qualitative questions on this survey now. We're doing a statewide analysis of this qualitative data. And things are shifting in the state, in the agency, how they think of data, right? Because of the work that we've done. So we really see this dominant equity strategy becoming more and more community-led and community-centered, which is the progression that we want. Another example I'll give you is Real D here in Oregon. And I'm doing a really bad job about not dropping the links in the chat. I apologize, y'all. I'm gonna try here. Thank you for your grace today. Okay, everyone, here we go. So this is the Real D in Oregon. It stands for race, ethnicity, language, and disability. And this is something that was community-led in 2013. So it's been many years coming where our community said, we need better disaggregated data at the state level. And it should be mandated that the Oregon Health Authority collect that. So this has been through various rulemaking processes, various iterations based off Oregon's communities of color and our population numbers, as well as the community-based organizations that exist in our state. This is an excellent resource. Check it out. There's a lot of really good information here. But again, this is something, and I'm going to show you an example in a second as to how someone used this towards more justice efforts. But this in itself is powerful. We need it, but it's still in the hands of the dominant. It's still going to be used at the discretion of the dominant, when it works, when it fits, when it doesn't. Right? And the whole getting on board process, we got to do that work, but it's distinctive from justice work, and that matters. All right, and quick example here is the GARE model. I'm sure a lot of you may be familiar with this. This was something that came out of a Black-led organization in getting government to think about the questions they need to ask to have more inclusive research. Right? This can be really powerful. It can be really weak. I've seen both examples, but again, this is an equity strategy. This is something that gets an organization to shift differently and be a little different, but it's not necessarily grounded in a community vision or something that community is driving, yet it's attempting to get the dominant there, to get them closer to that kind of work. Okay, so I focus on those dominant equity strategies. Now I'm going to talk a little bit about community equity strategies, because I feel like these are strategies that have advanced that equity work, that have made it more community-centered, more community-led, and is leading more towards justice efforts here. So, and I do have some examples. I have one example I'm going to walk through here, but let me just share these here with you. The big one that we see a lot is not seeing or believing narratives and stories as valid data. Y'all probably hear this word anecdotal a lot. Maybe you even use it sometimes. That word means not grounded in truth. So every time someone says this Black woman's story about her children's experience in this school district is anecdotal, you're literally saying it's not grounded in any evidence or truth. And we use that, the dominant uses that term so much to sort of dismiss qualitative data, to dismiss the ways in which our community shares their truth and their knowledge, which is through narrative, through story, right? Through words. And so really thinking about how narratives and stories are valid data, and that they are important to help us understand the structural, to help us think more actionably, and to really think about what contexts are creating what barriers, right? This is essential for making that equity approach more geared towards community, more geared towards justice. Focus on systems, not aggregates of individuals. As I mentioned earlier, there's some really great work happening out there in quant-crit studies, quantitative critical studies. Amazing women of color leading some of that work, thinking about how do we quantify systems and how systems are racist or reproduce racialization, racism, right? Instead of focusing on what all natives are experiencing as if that indicator is really telling us about native populations. There's not a lot of meaning there, right? But the systems that produce inequities for these communities, that's different. What data do we really already have, and what does it tell us? I don't know how many agencies I work with who are like, we want to ask the community about what transportation justice looks like. And I'm like, you've engaged them 25 times in the last 10 years. They don't want to tell you again. You already know, and you're not accountable because you're not tracking this information. So tracking and being accountable to what you've already learned from community. And I'm using this in a government example, but I think in any example, especially for academics, right? Understanding the progression of community work and community thinking and strategizing and to be able to build off of that, right? That's essential. Translating dominant perspectives and language to resonate with community. So we did a big survey where we didn't use the word behavioral health because our community said that's not going to resonate, and that's not going to translate across 7 languages either, meaningfully at least. So we came up with social and emotional well-being, right? As terms that we worked with community to think, well, what does this really mean? What are we really trying to understand here? Now we see this term, we did it in one survey, we've seen like 7 RFPs now come out from different agencies across our state that are using this term now to connect more with community, right? So, and that can be good and bad, and we can talk about that. But the point is, we are seeing these equity strategies becoming more and more leaning towards justice because they're centering community more, on honoring community more, and deferring to community more. Strength-based, I don't need to go into this one, everyone knows this. Diversity of data, we think of this as, not just one data set, but what is multiple data sets? What are multiple pieces of art? What about community conversations? What about all of this information as evidence, as data? And we make decisions based off of a diversity of data, not just a census tract, right? So this is a thought of getting the dominant and equity strategies to think more broadly about what constitutes as knowledge and evidence. Holding the dominant accountable, I'll give you an example of this in a second. Identifying community questions and how they differ from dominant questions, and then making meaning of analysis in community vetting sessions. So I'm going to give you just these quick examples here. So hopefully this will make a little bit more sense to you. One of the things that we write are equity notes. When an RFP is really messed up, I just write them a note and say, hey, funder, hey, agency, this is harmful, and this is why. These short turnaround times don't allow me to work on with community. There's a lack of community outreach and questions in the RFP. Clearly, you don't see community anywhere in this work either, right? And the list goes on and on and on. But we have these examples of how we can bring folks in, and that includes funders. So we always share this as an example, like don't be scared to tell someone that what they're asking of community is harmful and actually not going to produce the right conditions for justice, right? Because that is ultimately our goal. So we wrote this in the RFP. I didn't think we'd get the money because I was pretty bold. Well, then they were like, oh, we love it. We want you to do it. And so we're like, okay, so we're going to do this our way, right? And one of the things that we were tasked to do was to write about the racial wealth gap. And instead of using, which, well, we did, we still used all the dominant data because we wanted to demonstrate what was publicly available, but we spent a lot of time in community, particularly with Black, Latina, and Native communities, thinking about what wealth means to them and what are those narratives for them, right? And thinking about these narrative shifts around wealth and around what closing a wealth gap would look like, would have to include these narratives, right? So this was a really powerful way to honor our community and what this means to them, as well as bringing the dominant along and thinking, if you're not centering these narratives in your wealth building program, you're not getting it, right? Offering a financial class, that's not grounded in what these communities think of as wealth, right? So that narrative shift was really, really crucial. And I'll drop a link to this here too. This is the cover report, which is done by a student, which is really cool. But I just wanted to show you this last part here was this community vetting session where we started going through the really messy thing in the right-hand corner. We started going through all of these data with community, right? And asking them all these questions and asking them to rank things or decide how this looks different than the dominant, and had a really exciting exercise that really helped us think about all the interviews that we collected, all the information we gathered to really make sure that we were honoring what community was saying. So ultimately, this report was really powerful, and I think it shifted a lot of things, but I don't know. And it's not really being driven by community. So I don't think of this as justice, but I do think of this as an equity approach that does set the conditions for justice, right? Okay, so let's get to some of these examples of community justice strategies. So I have examples for all of these, except for the data sovereignty protocols. So let me just talk about that briefly. Some of our community-based organizations are unwilling to work with organizations, and this could be academics. This example is actually from the University of Oregon. Because the University of Oregon was not willing to sign a data sovereignty agreement, then this community-based organization was like, no, thank you, we're not interested. So data sovereignty protocol is, or a research charter is another example that you can use to make sure that we're on the same page about who owns what information and about how that information will be used. That is fundamental to justice, right? That we have ownership over our ideas and our strategies, and that we get to make decisions about how they're used. And I'm going to go through some of these other examples as I show you here about some of the work that's happening here in Oregon. Oh yeah, let me drop this one here. Before I jump into there, I do want to share this article with you all. I'm going to drop it here in the chat. I will get you all these, by the way. I'm sorry I'm a little slow here, but this is one of my favorite pieces to read as a community researcher. I come back to it a lot. Indigenous scholar Eve Tuck, letter of suspending damage. Really what she's talking about are desire-based frameworks. That she's talking about that the way, yes, of course, we want to move away from deficit, and often we see that as strengths, but it isn't just about strength. It's about desire. It's about what do we desire for our children, for the generations to come, right? What desires that our ancestors leave us with that have not been addressed or dealt with, right? Those desires are more than just my strengths or more than just the deficits or needs that we have. And to build just systems, we need that sort of thinking, that sort of framework, right? So read the letter. I promise it'll be meaningful to you, I think. But this was really important, and I want to center this because you're going to see this a lot throughout these examples. Okay. So the first example I have here is from one of our colleagues at the Oregon Pacific Islander Coalition. I'm dropping the link in the chat here to the reports. This was one of the reports that we did for that survey modernization work that I described earlier with the student health survey. But I love sharing this example because here is a dominant institution, the Oregon Health Authority, working with Pacific Islanders, a coalition of them, right, who have historically been erased because of margin of errors, because of statistical packages and standards that we have for what data is valid, right, have just been fundamentally erased from the picture of health in Oregon because of the tools they use for data. So they've been in a long process of reimagining what health looks like for them and how they as a community themselves would measure health, right? So here you see this fishbone scale that really comes from community, right? That says, that is on an abundance scale, right? Less abundance, more abundance. And that isn't just about myself, but it's about my family and my community and how all those things can be included in what means health to me and my people, right? So this is something that is pretty amazing that this community group spent a lot of time developing and thinking grounded in their cultural values as to how they would assess health and what that looks like, right? And this was supported by the Oregon Health Authority, and it's having other impacts downstream that I don't know about yet, but we're getting there. And more things like this are leading us towards justice. So I don't want to paint the picture that justice work cannot be supported by the dominant. That is not the case. We need the dominant. We need academics. We need agencies. We need your support, right? But it's about deferring that power, deferring that model that you're stuck on, deferring on the way you all do things to letting a community decide how they want to do things, right? And the ways they want to do them. So this is one example I have here. Another example I have for you is a lot of data that we've collected during the 100 days of protests in Portland. I'm sure a lot of you've heard about this after the murder of George Floyd, the racial uprising that happened here in our city. And we have a community data crowdsourcing tool called Portland United Against Hate, where people can report hate PDX, where people can go and report their incidences of hate. We ramped this tool up a lot during the protests. We already had that tool in place before we started, and then we spent a lot more time in the field collecting more evidence and more voices from the streets. So the report really focuses on the testimonies of police brutality that were experienced during that time, right? So we see this as community defining what their experiences are, what truths are being concealed in the dominant, right? And as a way of leveraging community identifying their own experiences of hate and what that means for them, to tell a narrative that's more centered in justice. It's more centered in what really needs to shift for us to have better systems. All right. I also think about the equity fund, the Oregon Early Childhood Equity Fund evaluation. So if any of y'all are evaluators out there, this is a really great example of how I've seen academics support the work of communities in doing a lot of the behind the scene work, right? Of organizing a community body, but letting that community body of practitioners and parents and advocates make the decisions about what should get funded, right? And how the programs should be evaluated on what's getting funded in ways that are culturally specific, right? So these committees are building this thing, but they're also working in organizations and full-time jobs, right? They can't do all the thing. And this is where the technical assistance, the financial support, and the other guidance from dominant institutions and academic partners is really profound, right? Because they can help really elevate what communities are already trying to do, trying to help community better define or to better organize what they're already doing, right? You're not doing it for them. You're not saving them. All you're doing is providing them the capacity and support to envision and do what they really want to do. So this is a really great example. I put it there in the link so you can read the report if you'd like. All right, coming here on my last few examples, I want to talk about the Oregon Water Justice Framework. This is another really beautiful piece of work, and I'll drop the summary link here for you. That really brought together academics, community-based organizations, some agencies into building this framework for the state of Oregon that was really grounded in Indigenous and other BIPOC communities, environmental justice communities, desires for how we would create water justice in our state, right? And this was a very long process to create this that we were really involved in. But as I said, it wasn't just us or a few partners. This was a statewide collaborative that really centered and grounded community knowledge and desire. So I love sharing this example because we had some really thoughtful university partners who really fought for us so that the university did not have as much power over this work as they originally wanted to. Oregon Center for Public Policy put out this article put out this little project called Data for the People. This might not be terribly interesting to everyone in Chicagoland, but I share this because what they did is they took those REAL-D standards that I showed you earlier, the race, ethnicity, language, disability, and they applied them to how they normally analyze policy data, right? And not only did they do that, they also reached out to communities like Pacific Islanders, right, who are often erased, and Pacific Islanders who are like, please don't aggregate us, like keep us in our own category because that's really important to us. And please show it this way, even if the numbers are small, show that number, right? And then they talked to Native communities and they said, please aggregate us. We want to be aggregated. I know that doesn't really describe all of us, but that shows that we're here, right? So this is a really, these were important justice-orientated goals for these communities grounded in an equity strategy, right? And for OCPP to really take this on and start making this sort of the dominant way in our state by saying, hey, in our state of Oregon, if you're going to use these kinds of publicly available data, you better run them through REAL-D. You better have them be representative of these communities and you better engage with them to talk about them and what this means before you put it out there. And that sort of piggybacks on my last example that I have here for you, which is around the data genocide of American Indians and Alaska Natives. So the Urban Indian Health Institute, which is just north of us in Seattle, has created this scorecard to assess really whether or not data about their communities was being presented, was actually being collected, right? And on the surface, having better disaggregated data may seem like a simple equity strategy, and it can be depending how you use it. But for Indigenous folks, and particularly Native Americans in our region here, erasure is fundamental to colonization. So not being seen in the numbers isn't just about more funding. This is actually a critical tenet to how Native folks have been erased from our society, right? And so this is more than just, the strategy isn't just upon, whether it's dominant or not, but it's the intention of it. It's the use of it, of how that's grounded in community truth, community knowledge, and community desire, which is around ending the erasure of Native and Indigenous peoples. Okay, I've talked a lot, and it feels really awkward doing these seminar things because I can't see all your beautiful faces. But I just want to end with, I'm not going to run through this because we're running a little low on time, and I really want to spend some time talking with you all. But we are building a equity and justice continuum as a model, as a framework, that really describes a lot of the pieces that I said today during the presentation about what feels like equity, what feels like justice. What does that look like? What are the tangible examples and steps that get us towards better equity work that really sets the conditions for justice, right? So how do we do this work in a way that really defers power to community in ways that is meaningful and that it's about, and that will help bring community together that then they can use for their justice efforts that will ultimately replace dominant structures to really support community self-determination, right? And I see that this is a really lofty goal. I don't even know if it's really a goal. It's really more of a process, and thinking about how these two things really affect each other and how one without the other is very challenging in our society. And we really need to have a better crucial lens of that equity work, and how it's deferring to community and how it's leading to supporting the conditions of justice, not leading it for its own effort. In order for us to have really meaningful research and data practices that support racial justice. So I'll leave you all here with just some takeaways, and I would want to defer the rest of the time for Q&A. So I'll say research and data equity, we need creative, diverse, community-led equity strategies that are lasting, they're sticky, they have traction, right? That support the conditions for justice work. And we only really know that justice work, right, if we're doing good equity work, because we'll hear it from community. They will tell us, they will guide us. And then the justice work, communities of colors are experts in their lived experience. They carry with them generations of wisdom and knowledge. We need their desires and strategies to create new systems that create the conditions for self-determination and justice for all peoples. Thank you. I'd love to engage more with you, hear more of your thoughts, and I hope that we'll continue to grow together in this fight for racial justice that centers communities of color. All right, I'm gonna stop sharing.
Fantastic. Dr. Lopez, you gave us so much to think about, and I really appreciate all the concrete examples that you shared as well. I hope you're going to get a chance to look in the chat at all of the congratulations and gratitude that's being showered on you. So I want to take a minute, my mind is spinning, but I want to start with a question of my own, really building on that takeaway in the middle that you shared with us. As you show in so many of your examples, increasingly dominant institutions are recognizing the need to further center communities, but these efforts to center are often without the deep or adequate resources to meaningfully support them, which can often lead to actually further burdening communities. So I wondered if you could speak a little bit to how that centering is done in a way, examples of ways that that centering is done in a meaningful way that doesn't add further burden and can really ask dominant institutions to leverage their power and privilege to shift, as you say, to advocate more for racial justice approaches.
Yeah, thanks, Jen. I mean, the big three for me are unrestricted resources, technical assistance, and getting out of the way. Which getting out of the way is not as simple as just getting out of the way. It is actually shifting organizational culture. So that takes quite a bit of work to get out of the way, actually. But I really see those as the three main things that get us to a better understanding of centering justice, and also paying attention to what's already happening. I mean, one of the things that I called out about, we ask governments all the time to do an assessment of what they've already heard from community as a sort of a baseline knowledge assessment, so that they can have a baseline of what they've already heard from community, what they've acted on, what they were able to advance, and what they haven't, or what feels out of scope for them or out of reach for them. But just to be able to be honest that, hey, we have heard you. Yes, we are taking you seriously. Here's what we can do. Here's what we can't do. And we see that this is a future goal of yours that's more in the future for us, but we want to build towards that thing, right? So just paying attention to what community's already doing and acknowledging that and what you've already heard from them is also a really critical step.
That's really helpful. A brief question in the chat, and then I'll start to go to some of our Q&A questions. Someone specifically asked about the term data genocide and wondered if that was a term of yours, and they would like to use that in their teaching and want to credit the appropriate source.
Yeah, the Northwest Indian Health Foundation. I will drop the link here for you. This is a term that they created, and we are in good relationship with them. They're doing some amazing work out there, so you can learn a little bit more about what they're doing with that campaign. It's also moving on to missing and murdered Indigenous women as well. So they're applying similar strategies around that.
Thank you so much. Yeah, and there's a question about links. We will work to save the chat and share all of the resources that Dr. Lopez is sharing. So going to the Q&A, there was a question from a participant who thanks you for the presentation of the resources and notes that they're leading a national DEIA advisory committee. And they're wondering if you could point to any tools related to research to practice in terms of community engagement with equity and justice work.
There are some examples that I can share with you. They're not going to use the language we're using because no one is. And I think that's part of why I want to distinguish this language so that community efforts are seen as such and are able to grow as such and not co-opted by the dominant or by equity approaches, which they often are, which then become diluted and watered down. So these distinctions feel really critical, and providing more examples and how they work together is sort of the work we're doing. So we will be putting a community data report out this summer, and that will talk about examples of community data and what that looks like here in Oregon. But I can certainly share a list of other resources that we often pair, and I'll get those to you, Jen, so you can send out to everybody.
Great. Here's another question from a community partner. Great presentation. How do you advocate in a reality of the commodification in this nation of basic human needs? For example, the biggest affordable housing program is based on tax credits for investors. And then they added, just to elaborate, we are forced to actually argue using the dominant metrics of healthy communities as those that in fact displace people through surging land values, quote unquote.
Yeah, oh, that's a great question. I mean, the thing that I try to do most with the dominant is try to help them understand how racist their metrics are, to really help them. And when I say racist, I know that's jarring for some people, but it's really more about, privileging white folks, right? Like using data that actually is more representative and more reliable to make decisions for white people than it is for communities of color. And that sort of language seems to be getting some traction for me. But ultimately, I think a lot of times what the dominant needs is their data, and then for them to see other data, right? That diversity of data concept that I talked about, so that they can see exactly why their data that they're relying on so heavily to make these decisions is so insufficient and really lacks action, context, and structure. Because those are the things that narrative and stories provide us, the qualitative. And it doesn't have to just be qualitative. You can also do community surveys that are quantitative as well. But I think that is the biggest sort of shift away from those metrics, right? Is that they want to prove this thing is real. And that's fine. That's one way of proving that thing is real. Here are other ways of proving that these things are real. And you're really not using this information to make sounder decisions. So trying to do that education while also demonstrating what's available. And a lot of times community-based organizations don't see themselves as researchers. They don't see their knowledge or their evidence as data. And that is also something that we spend a lot of time doing training with our CBOs and with helping them understand, like you spoke to 300 native families this week. Like, you are like the fiercest data person we have in this state. What are you talking about? Right? But they don't, oh, but I don't know how to track it. It's not scientific, or, so I think there's all this hesitation of putting our knowledge and our truth out there. And this is, I think, where academics and other folks can help to organize some of this information and help be more digestible, more meaningful to dominant actors who may not see that as knowledge or valid or reliable, but fundamentally is. So to me, that is the biggest case of why I am arguing for justice approaches, is because all of that evidence really is grounded in those things. And it's not going to be in some community metric that we've been using for 25 years that really hasn't gotten us very far at all. And as you point out, in fact, is producing more harm by relying on it.
Fantastic. Another question from the Q&A. What happens when a personal story or personal observation story does not convey the whole story? For example, I am a Black woman. My cousin starts telling me a story about how she sees a, quote, new epidemic of Black teen moms, quote, unquote, but she was working at one of the only clinics in her city where Black teen moms can get care. I tried to talk to her about this not being reflective of data trends for Black teen pregnancy, and she did not believe me. So how would you recommend shifting this kind of story, i.e., how to support teen moms for good outcomes with data?
Well, that's an excellent question. I would say both are true, right? That the trends are true to an extent, right? To the extent of the limits of that methodology, of who participated, of how we've categorized people, right? And there's evidence there, that there's some truth there. And there's also truth in that story, in that experience. And for me, I think what gives that lived experience, that data from lived experience more value, is when we can gather just a little bit more of it, right? Some qualitative scholars say you only need 12 cases or less to argue, to reach saturation, a point of saturation, and argue that something is meaningful here, right? So I think that using lived experience and gathering as much of that lived experience as you can. One issue is the lack of rigorous qualitative analysis, which is something we're working really intently on, is providing better training and understanding about how to do qualitative analysis, because most of the times it's really either qualitative data that becomes quantified, or cherry picking of quotes to provide context or feeling, like, and that's not really analysis. That's not actually telling us about what do 25 Black teen moms in Chicago are experiencing. What are these barriers? What got them here? What are the things that are helping them feel successful and thrive, right? Like, those kinds of things you're never going to get in that trend data. And that's okay, right? They're different sources of evidence, but they should all be seen as valid and meaningful. And so I think the more rigorous we can get at analyzing lived experience and presenting it in a more formal, structured way, and using some quantitative data even to demonstrate what the qualitative is already telling us. We do that a lot with, I could drop our Leading with Race report that we did. We do that a lot with using community data to then say this experience here, even though it's grounded in 4 stories, is actually a trend, or it does actually exist, right? Or maybe the trend data is conflicting to that, and that is also data. That is also a problem. Why is this trend data conflicting with this reality for this group of folks? Something's going on here. So it's always leading to more questions, right? Good research always leads us to more questions. And then the better we can get at answering those questions with lived experience, I think the closer we get to justice.
Thank you. Another question in the chat said, you talked about TA, I think technical assistance, being one thing communities need to get us to a better place of centering justice. Most community experts have no data analysis skills using Eurocentric frameworks and tools. How do you help them to do quote unquote data work without being an MPH, Masters of Public Health, or Tableau guru?
Yeah. Well, community, in many ways, are already collecting evidence about their experiences, about their desires, right? They sometimes need technical assistance to collect more of that, maybe to collect it in a somewhat uniform way. We use things sometimes like multiple case studies as a way to not limit what one group wants to better understand or make sense of their truths, but how that connects to various groups trying to answer similar questions or experiencing similar things. So there's some methodological strategizing that can be offered with technical assistance. But I really would ask the community how they make meaning of these things, right? And detail what that process is, and try to guide them in a process of vetting information or prioritizing. This is a really tough one in community. Governments always want to know, what are the priorities? Give us the top 3 things, and we're like, how do I prioritize, right? Like safety with food and housing stability, right? Like I can't prioritize these things. They're all connected. So, but community has a way of talking about why some things are more front of mind than other, or why something, or how something can be addressed that can also support multiple things, right? That we don't have to think of housing, a housing strategy as just being about housing, right? And so I think community, when given the opportunity and given the time to be creative and to be thoughtful, you look, that bonefish model, for example, right? Like that took a long time. You're talking about a lot of like Pacific Islander elders who have no idea about these kinds of things, right? But they came up with that together. And it was 1 or 2 researchers, right? And they actually created a community research worker model, just like a traditional healthcare, or traditional healthcare. Oh my goodness, I'm sorry. Traditional worker. Help me here, Jen.
Community health worker.
Thank you. Community health worker, traditional health worker. But they did that with community research, right? Where they really started training their own community members about how do we gather our knowledges? What is it grounded in? What does that mean? And how do we make sense of it? And even the question of measuring, I don't think it's a beginning place. I think it's a place at the end, right? Once you know of how information is gathered, what's meaningful, what's desired, how we get there, then you start thinking about, well, is this measurable? How do we translate this, right, to whatever dominant context that we're stepping into? And I think that's really the goal of being like the sidekick, the behind the scene worker, the encourager, the cheerleader, the someone who's holding together the things that everyone else doesn't have capacity for, without you being centered in that work.
The Q&A is full. I'm going to try to squeeze in one more question before our hour is up. So we have someone who asked, what are the signals you look for to tell whether an entity is open to a justice approach, as the talk is far easier than the walk?
Oh, yeah, that's really good. We're actually trying to develop a screener of questions that we would ask any dominant institution we're working with, to sort of assess where they're at. But a lot of it is, how much control are they looking for over the products? How much check-in are they looking for? How much are they documenting everything we're doing, right? These tenets of white supremacy culture, like when we start seeing them in our relationship with them, we start getting a better sense of, oh, okay, maybe you're not there yet. And I think this is really important with equity work. This is why I don't want to poo-poo on equity work. I don't want to say equity work is bad or not needed. Some organizations are really, really far off, and they still need steps. They still need a direction, right? And I think assessing where someone is at and what's possible for them is actually more important in equity work than trying to assess if they're ready for justice. I think the people ready for justice have already been doing the work for years, and they're already demonstrating that. A lot more, it's about getting people closer into understanding equity before they can get there.
Thank you so much. All of everything that you've shared today has not only been so helpful in terms of really practical tools and examples that you've given, but just also a lot of things food for thought, future discussion. We look forward to hosting additional conversations to dig deeper into the concepts and the examples that Dr. Lopez has raised here in the Chicagoland area. And we hope to continue connecting with Dr. Lopez and his colleagues at the Research Justice Institute to talk about ways we can continue to collaborate. Thankful for everyone who joined us today. We will be sharing the recording as well as the questions that we didn't get to and the links from the chat. And again, Andres, I hope you get a chance to look at the chat because it's just full of amazing things back at you about what you shared today. So thanks everyone for joining. Enjoy this beautiful spring weather. And this will be posted also at the Institute for Public Health and Medicine at Northwestern's website. Thanks again.
Thank you all.